I work as a nurse in Washington, D.C. At Washington Hospital Center.
I am an assistant professor of nursing at the University of Sioux Falls.
I'm a certified family nurse practitioner. I practice in women's health for the Geisinger Health System out of our Scranton office.
Specifically, what kind of bridged me into the medical field was, as a social worker, I worked with people who were HIV positive, and I did that for a few years and really enjoyed it. That kind of segued into becoming a midwife. Having that experience in HIV really helped me.
I always knew that I wanted to go back to school for something, but I wasn't sure what. And I worked in several different areas as a nurse, one of them being labor and delivery. And I fell in love with that. But I also knew I loved teaching, and I've been teaching for several years now. But I really missed being at the bedside with patients and having that hands-on experience with them and being there for those special moments. So I decided to go back for my postmasters in nurse-midwifery.
For me, being that midwife, being able to take them from routine GYN visits to the antepartum phase, intrapartum phase, and then for the delivery phase and postpartum follow-up is going to be something that's going to be achievable and has been one of my goals since first setting out as a nurse.
Shenandoah is kind of giving me that more advanced knowledge in midwifery practice in women's health. What is wonderful about that is that instead of having to take 3 years of education to complete both the master's and a certificate, I can do it in 2 years. And so the work that I'm doing here in Shenandoah counts toward my master's degree at GW.
I've been learning so much in the program. I've gotten a lot of great hands-on experience with clinical experiences in my area that I'm from, which is South Dakota, and I can learn online from my home. So that's been really great for me because I'm a mom. I'm still working, and I'm able to still go to school and complete my degree and finish my dream.
Shenandoah is allowing me to fulfill my goals through the process of a kind of online, semi-participative insofar as college attendance and being able to work and have a family life.
It's nice to be able to pursue my own interests, what types of things I want to do in my career afterward. It's not just about learning about midwifery, it's about learning how I'm going to practice midwifery in the communities that I'm already serving.
What I love about it is I have a lot of options, and I'd love to blend both worlds together to be able to teach, which I feel like all nurses do, and nurse midwives, and to be able to have that patient contact that I love. So in some way, my two worlds will hopefully blend together.
As an adult, it's sometimes harder and as a provider, it's harder to take on that role of a student, but they give you that equality, that collegial equity, you know, that you need when you're trying to do this. You're trying to go back to the student role, I should say.
Shenandoah is really good for folks who are passionate about certain things.
It's a very doable, very easy program to work with to be able to achieve your goal.
I would say if it's in your heart and you feel like you're called to this, you should go for it.